The kind of procedure we performed here was an endoscopic approach, utilizing a very small camera through a cannula to be able to address the disc extrusion or disc herniation that was present in this case.
I was actually playing golf, and on the fourth hole, hit a shot, and I felt something kind of pop in my back. I had actually herniated a disc.
I was working at my house, I lifted a table. I felt a twinge in my back. I had a disc herniation, it was an extrusion, which is the worst one.
As a surgeon, I have multiple tools that are available to me, and I try to emphasize that to my patients. No patient is going to be the same. No pathology that they present with is going to be the same. However, with the endoscopic technique, it is the absolute least invasive approach that I have available that I can provide to my patients. So what we have here is my standard pen that I use to mark patients or sign consents. This is the cannula that we have in comparison to that, so you can see how small that cannula is. And again, you can see how this endoscope fits through this very small portion of the cannula. This is going to be then our viewing area. The camera has the lens up front so that we can view the pathology on a very small scale, and it has a working channel where most of the instruments then fit through that working channel to be able to then perform the procedure.
The really awesome thing is that, when I left surgery, I had a little Band-Aid on my back. Procedure that they were able to do was very, very minimally invasive. And so that was reassuring as well, that I wasn't going to have to be really laid up for a long period of time.
I barely felt a nick, as far as where the incision went in. There was no pain from them doing the surgery. If you said point to the spot where they cut you, I couldn't do it. I would have to see it in the mirror. That's how minimally invasive it was.
So the recovery time is typically within a couple of days after surgery. A lot of times patients wake up immediately having found relief of symptoms. If there's an offending agent, a big disc herniation or disc fragment is pressing up the nerve and we're able to get that nerve symptoms goes away right away. And so again, the dilation approach also minimizes the post-op recovery time. And so patients are back to normal activities much, much faster.
It was walk in pain, walk out pain-free. And then slowly I introduced golf, swimming, back into my routine, just taking it a little easy until I got back to being able to do a full golf swing. Now I'm back to still hiking and riding my bike and swimming and playing golf 3 or 4 times a week.
Dr. Salari was everything that, my chiropractor had made him out to be. He was fantastic. He said that I could be up walking around and going to a football game 3 days later. I was just pretty impressed.
Here at DISC, Dr. Anthony Young was one of the original inventors of a lot of the equipment that is utilized out there. And so we have been performing this endoscopic approach for decades. And so we have a combined several decades of worth of experience performing this. In fact, we have a lot of other surgeons from not just national level, but also international level, who come here to train under Dr. Young and under us to be able to perform this least invasive approach for their patients.